If you have ever been to a hospital or urgent care, the odds are you or your parents have been asked if they have medical insurance. Usually, if they are covered, an insurance card is pulled out and data is entered in the system to help reduce the bill. But what is health insurance, and why do we have it? Health insurance is a legal entitlement to payment or reimbursement for your healthcare costs, and it's generally under a contract with a health insurance company. The system of health insurance that we know of today was developed in the 1930s during the Great Depression. Before the 1930s, health insurance was a system known as disability income insurance. Medical technology was not very advanced, and prior to the 1920s, most surgeries were actually performed in people's homes. With the horrendous of medical bills, people were more afraid of missing wages due to sickness, and at the time this was known as sickness insurance, which was the precursor to health insurance. What's the problem with health insurance in America? Well, the simple answer is that insurance companies are corrupt, healthcare is misdirected, and we live in a dog-eat-dog country. America has one of the highest costs of healthcare in the world. 54% of patients in America have difficulty paying for health insurance, while commercial insurers are earning record-high profits. America's largest health insurers raked in more than $41 billion of profits in 2022. And with all that profit being made by insurance companies, one would assume that Americans would have access to high-quality healthcare, but sadly this is not the case. New research conducted by Morning Consult on behalf of the HAA shows the severity of the problem. 62% of the 1,500-plus patients surveyed say treatment has been delayed because of their insurance provider, a trend that caused many of these patients to reportedly become sicker. For example, Paula Chestnut, a 67-year-old woman who smoked most of her life, was frustrated that the MRI she needed to determine her risk of lung cancer kept getting denied because her insurer deemed it unnecessary. Following further complications, she was later rushed to the ER, where doctors discovered a massive tumor. The delays caused by prior authorization needed by insurance companies limited her options, and less than 6 weeks later, she died. In 2022, 8.4% of Americans were uninsured. That means 27.6 million Americans could be in a lifetime of debt due to the inability to access insurance. An uninsured broken arm would run you at around $40,000, while having a stroke would cost you $70,000. Although the price tag of our care is so high, the U.S. scores poorly on many health measures, some main issues being life expectancy, infant mortality, and unmanaged diabetes. Healthcare disparities are not out of the ordinary. It's a simple, skewed system. Those who are in the most need of medical treatments but can least afford its high costs are denied or delayed treatment. The avoidable favoring puts people of color, individuals struggling with poverty, and other disadvantaged groups at risk. According to the National Health Council, poverty is directly correlated to poor health outcomes. Another aspect to keep in mind is the unaffordability of medications and fresh foods in low-income areas. The National Library of Medicine states that access to fresh produce and other healthy foods differ between poor ethnic and wealthier non-ethnic neighborhoods. Investments made in healthcare are heavily misdirected. American healthcare overemphasizes expensive and unnecessary procedures and drugs. Instead of focusing on preventable factors or easy fixes, insurers will most likely only cover drugs or surgical treatment. An example of this is the fact that a cortisone injection for tendinitis in the ankle is typically covered by health insurance, while a simple shoe insert that might work the same is not. Reintroducing the inability to access fresh and healthy foods, the uncontrolled chemicals and additives in America may also contribute to the dependency on medication. Pharmaceutical companies would lose billions of dollars if the need for prescription medications decreased. And money lost in the pharmaceutical industry will also result in decreased marginal profits for insurance companies, further proving how linear the corruption in American healthcare and insurance is. The outstanding barriers relating to healthcare insurance in America have low chances of resolution due to the polarization of political parties. Many argue that providing universal healthcare and health regulations are unconstitutional and extremist, which could override the ability to create an effective solution. But one thing to keep in mind is that America has had socialist policies and programs that have benefited citizens for decades. Some examples are Social Security, child labor laws, and agricultural subsidies. Government aid is not evil, and benefits given to citizens can help the 1 in 12 Americans struggling to pay their medical bills. Maybe the path towards affordable and accessible health care is not too far in the future.